Hello viewers, welcome to Uron, Urologist on Air. So once again we are having a very serious conversation with one of the very prominent doctors of all the time across India. So before starting anything, I'd like to introduce you all to our Honorable Doctor. Sir, can you please introduce yourself to the viewers?
I am Dr. Amitabh Kumar Sinha. I am practicing at Patna. I have my own setup, Sheila Urology and Laparoscopy Center. During this USICON, I am the Joint Organizing Secretary and I was the coordinator of Euromed program.
So my first topic is UTI. So one of the questions that I would like to ask you, because this is a very common question, what are the thoughts on UTI associated with kidney stones? So how are they correlated?
Most of the kidney stones, we say their nucleus is some bacteria, some infection. Once there is infected something, then it keeps on forming stone. Take it otherwise also. If the patient has got kidney stone, he will have or he or she will have recurrent UTI. So preventing a stone formation, most important thing is keep urine sterile. If the urine will be infected, he or she is going to make the stone again and again.
Okay, sir. One more question. Will you prefer urinary alkalizer with cranberry to treat UTI associated with kidney stones?
This is in last few years, I will say, we have started giving alkalizer with cranberry for a pretty long time. Long time means 8 to 9 months. It has got 2-3 effects. Alkalizing the urine, increasing the stone preventing substances in the urine, as well as it's work as a chemoprophylaxis, means preventing infection to occur. So it works both ways. And in my personal experience, I have seen, since I have started giving these medicines for a pretty long time, stone recurrences has come down to a pretty low level.
Okay, sir. We would like to throw some insight on next thing, which is kidney stone, which is very common these days. So one of the very important questions which is related to kidney stones. What is the greatest misconceptions that you think is that people have about the kidney stones?
First thing, what they think is kidney stone is a familial thing, genetic thing. My father, my mother, brother, sister, they were having, so I am going to have it. Second thing, the misconception is, if you take plenty of water, you won't form a stone. But the way of water intake is wrong. Even if they are taking 4 or 5 liters, they are taking a liter in one go.
Okay, yeah.
So they are hydrating himself or herself for few hours, and next remaining interval of 3 to 4 hours they are in a way dehydrated.
Dehydrated, yeah.
So that promotes more and more stone formation.
Yeah.
So this is the most common myth among the general public.
So they have to be hydrated on a regular basis.
Regular basis, we say
On regular intervals they
don't
should.
take more than a glass in one go, but
Yeah.
take every hour.
Every hour, right. Sir, the next thing is overactive bladder. So this is also a very common problem these days, especially in the men. So can you please describe for the audience viewing this that what is an overactive bladder and how does it impact the quality of life of a patient?
See, our bladder, a healthy person's urinary bladder is in his or her control.
Yeah.
When we are resting, our bladder is filling with the urine. Once its volume reaches to about 300-350 ml, we start sensing, okay, there is some, I should go to washroom.
Yeah.
But I have time. If I am in the market, I can come back to home in next 10-15 minutes, then I can go to my washroom. But what happens in overactive bladder? Just reverse. Your bladder is out of your control.
Out of control, yeah.
So even if 100 ml of urine is there, suddenly bladder will start contracting on itself. And the moment you feel, okay, I think I am feeling washroom, before you realize, you leak.
Oh, yes.
So this is overactive bladder. Overactive bladder makes a person homebound.
Yeah, and
Now they cannot go to market, they cannot go
Social-
to temple, they cannot go to any cultural event.
correct.
So their quality of life becomes miserable in one line.
Yes, sir. One last question. One last question is, can patients with kidney stones have urinary tract infections at the same time?
Yeah, as I have told before also, urinary tract infection is a cause of stone formation,
Yes, sir.
and kidney stone being a foreign body is a cause for urinary tract infection.
Yeah.
So both can coexist quite a few times.
Okay. Thank you so much, sir, for your words, and I think you have shed a lot of knowledge to our viewers. Thank you so much, viewers. Thank you so much,
Thank
sir.
you.
Have a nice
Thank you.
day.